May date pa si Sir Roy mamaya para matapos tayo maaga. Meron ba kayong mga date later, mga anak?
Wala po.
Patingin nga mo,
Wala din po.
patingin mga picture nyo, siguro iba sa'yo nakaayos na. Tignan ko nga mga itsura nyo.
Wala, di pa pa nung.
Prepare na siguro, yung mga girls siguro nagkikilay na ngayong hapon pala para mamayang gabi ayos na isang mga kilay. Tsaka naka-rollers na yan. Tignan mo nga. Ang di magpakita may date mamaya. Okay, let's start. Okay, check ko lang po kung if you could see it and you can hear me well.
Yes po.
Okay, let's start. So the topic for this afternoon is about the development of nervous system, or you can also call it as neuroembryology. This will be the objectives for this lecture. At the end of this lecture, you should be able to discuss the development of the nervous system. Okay, we're going to discuss common congenital anomalies resulting from abnormal development of the nervous system. We're going to differentiate the types of neural tube defects and know the derivatives of the primary and the secondary brain vesicles. Okay? So let's start with a simple case. Prenatal screening showed that elevated maternal serum alpha-fetoprotein. Amniocentesis was done and confirmed with elevated alpha-fetoprotein. What should be included in the differential diagnosis? Okay, in the future you might encounter this. Okay, an increased levels of maternal serum alpha-fetoprotein, and this will help you. Okay, this is usually associated with a congenital anomaly, and we call it as neural tube defects, or commonly known as NTDs. And we have two types. We have the spinal bifida and anencephaly. So later in the lecture, we're going to differentiate again these two types of neural tube defects. Okay, you have to know the etiologies, you have to know the presentations. Okay, so you may when you go to your rotation in the future, you might encounter a baby born with a mass at the lumbar area, or in rare cases, you could see a baby born without a skull top or calvarium. So these are examples of neural tube defects, spinal bifida and anencephaly. Okay, let's review first the divisions of the nervous system. For you to fully understand the development, okay, of course, you should know the anatomical divisions of nervous system. We divide it into two types: CNS, commonly known as central nervous system, and PNS, peripheral nervous system. You have the brain and the spinal cord under your central nervous system, and you have the different cranial nerves and spinal nerves. Okay, cranial nerves emerging at the base of the brain, and spinal nerves emerging on the sides of the spinal cord, including the plexuses and ganglia as part of your peripheral nervous system. Okay, functionally, we have also two divisions. We have your autonomic and somatic nervous system. and autonomic, further divisible into sympathetic and parasympathetic. Okay, so we're concerned because our subject is anatomy. We're concerned with anatomical divisions: CNS, central nervous system, and PNS, peripheral nervous system. Okay, you're going to see this picture again and again, starting with this lecture until the end of neuroanatomy. Here's a cross section, a sagittal section of the brain showing you the parts. Again, these are parts of the brain. This is the cerebrum. This is the thalamus here. This part is the thalamus. Okay. This is the brain stem here, which is a collective term for midbrain. Here's the midbrain. Here's the pons. And this is the medulla oblongata. Okay. Plus, you have the cerebellum here at the posterior aspect. Okay. Again, our main concern for this afternoon is for you to trace the embryonic origin of these parts of the brain. So at the end of your lecture, you must be able to trace the embryonic origin of the parts of the brain. Neurulation means the process of formation of parts of the nervous system. Okay, neurulation. At the end of neurulation, important structures will be formed. You have the neural tube and the neural crest. Okay, these are two important structures to remember for this lecture: neural tube and neural crest. And these are the steps. You have the formation of neural plate and neural folds, and the closure of neural folds to form the neural tube. So these are two basic steps. We're going to discuss that later, okay, in details later. And at this point of time, developing embryo is referred as neurula. Okay, you have to remember that at this point of time during neurulation, we call it as neurula. Okay. So you're looking on the superior view, showing you the developing embryo. Okay, what signals the start of formation of nervous system or neurulation is the formation of this slipper-like plate of thickened epithelial cells. We call it as neural plate. Okay, we have to remember that. What signals the start of neurulation is the formation of what structure? Neural plate. Okay, coming from what germ layer? The answer is ectoderm. The embryonic ectoderm over the developing notochord will start to thicken to form an elongated slipper-like plate of thickened epithelial cells. And we're going to call it as neural plate. And the formation starts at third week of human development. So again, neural plate formation coming from ectoderm, third week of human development. Okay, I want you to imagine that we're going to have a cross section here. We're going to cut here. So you could see the developing structures. And this is what you're going to see. Okay, here's the neural plate earlier, and the neural plate will have two parts. Again, take note. The neural plate will have two parts on the sides. We call it as neural folds. And at the center, there's a depression. We call it as neural groove. Again, on the 18th day, the neural plate will invaginate along its central axis to form a longitudinal median neural groove and neural folds on the sides. Okay? Take note that you're going to see three colors here. The blue represents ectoderm, the red one represents mesoderm, and the yellow one represents endoderm. Okay? And this is the developing notochord. Notochord. Okay? Notochord. Okay, in your previous lecture, that will form the nucleus pulposus of the intervertebral disc. Okay, and that will induce, okay, the formation of neural flake. Okay, not the cord formation induces the formation, the development of neural flake. So what will happen? So here's a summary of the picture showing you the conversion of neural flake to neural tube. Again, you start here, first step, neural plate formation. Okay, coming from ectoderm over the developing notochord. And then the neural plate will have two parts. What are the two parts again? Neural folds on the sides, neural groove at the center. And look what will happen. The neural folds will start to move and fuse together. The movement of the neural folds, okay, the fusion will convert the neural tube will convert the neural plate, into a neural tube. Okay, did you get the steps? Again, let's start. First step, formation of neural plate. Neural plate will have two parts, neural folds and neural groove. And then the neural folds will start to move and fuse together. And the movement of the neural folds, the fusion, will result to formation of neural tube. Did you get it? Clear po?
Yes po.
Okay, very good. Okay. You will notice that, okay, look, let's go back to that picture. Aside from neural tube, some neuroectodermal cells will migrate on the sides. And that will become your neural crest. Again, some neuroectodermal cells will migrate dorsolaterally, okay, to become the neural crest. So at the end, again, two important structures form the neural tube, and then on the sides of it, you have the neural crest. Okay. Again, another picture showing you the neurulation. Here's the neural plate coming from ectoderm. Okay. The two parts, neural folds, neural groove, and the neural folds again will start to move and fuse together to convert it into a neural tube. So two terms that I want you to remember, neural tube and neural flake, neural crest. Again, what are derivatives? What will be the fate? Neural tube will become parts of CNS. And when you say CNS, you have the brain and spinal cord. While neural crest will give rise to parts of peripheral nervous system and autonomic nervous system, including the cranial nerves, spinal nerves, and autonomic ganglia, including the plexuses and ganglia. Okay, take note. Neural crest. Okay, let's go back. I think this was mentioned already during our lecture in the development of endocrine system. Remember adrenal gland? Adrenal gland has two parts coming from two embryonic origin. Adrenal cortex mesoderm, but the adrenal medulla coming from the chromatin cells of the adrenal medulla classified as neural crest derivatives. Neural crest coming from ectoderm. So again, go back to your lecture. Adrenal cortex mesoderm, but adrenal medulla ectoderm in origin, specifically coming from the neural crest. Okay, again, you have to go back to this clinical entity, congenital anomaly Hirschsprung-Suisse, otherwise known as congenital megacolon. There's absence of neural crest cell migration in the abnormal segment. Okay, neural crest will give rise to plexuses. What are important plexuses? to remember for GIT, you have the myenteric or Auerbach's plexus, which is for peristalsis, and you have the Meissner's plexus for secretory activity. Again, myenteric or Auerbach's plexus, located at the tunica muscularis, is for controlling movement, peristalsis, while Meissner's, located at the submucosa, is for controlling the secretory activity of GIT. Okay, take note that in Hirschsprung's disease, in the aganglionic segment, which means no myenteric, no Meissner's plexuses, okay, will be seen. Okay, absence. Okay, so I want you to go back to this picture. We've mentioned that there's a segment which is dilated and there's a segment which is constricted. Again, I want you to remember which one is normal, which one is abnormal. The dilated segment is normal, abnormal.
Abnormal.
Dilated is normal, abnormal.
Normal po.
Abnormal po.
Abnormal. While
Ayaw.
the, ano ba talaga? Normal, abnormal.
Abnormal po.
Yan tayo eh. Pumasa kayo ng micro A eh. Babalik ko kayo eh. Anybody from section B? Section B.
Normal.
Try to analyze it, di ba? This part, the constricted, is abnormal. It's not moving. It's not functional. Wala siyang myenteric plexus. Wala siyang Meissner's plexus. So the constricted part is abnormal, while the dilated part is normal. Kaya hindi po tayo. Ulit. Dilated is abnormal, normal.
Normal po.
Normal po.
Normal. Constricted is abnormal, normal.
Abnormal.
So, sino ang walang myenteric plexus dyan sa dalawang yan? Yung dilated or yung constricted?
Constricted.
Constricted. This is not moving. This is not functional. Okay? The normal segment, bakit nag-dilate? Kasi nga, naipon. How do you suspect if you have a baby born with Hirschsprung's disease?
No meconium.
No passage of meconium. The meconium accumulates in the normal segment. Kaya siya nag-dilate. Okay? When you go to your surgery, what is being done? Again, surgical removal. Tatanggalin yung abnormal segment. Sa surgery nyo na yung malalaman. Okay? Any questions so far?
None po.
Okay. This is the neural tube. Take note. The cranial 2/3 will become the brain, while the caudal 1/3 will become the spinal cord. You have to remember the concept that I gave to you. Neural tube will become the brain and spinal cord. Cranial 2/3 will become the brain, caudal 1/3 will become the spinal cord. Okay? Initially, we have openings. Okay? We call it as neuropore. So you have openings here. We call it as your cranial or rostral neuropore. And you have your caudal neuropore. Okay? It should close. Again, it should close. Cranial neuropore closes on the 25th day of development, while the caudal neuropore usually closes 2 days after the closure of the cranial neuropore, so which means it closes on the 27th day of development. Are we clear on that? Again, cranial neuropore closes on what day?
25th day.
Very good. And caudal neuropore closes on what day?
27.
27. Malinaw ha? Baka naman sumagot kayo, caudal neuropore closes on what day? Ako sinasabi ko na, alam ko na, merong sasagot ng 2 days later. Masyado kasi kayong dinidibdib. Ako, 2 days later. Ano 2 days later? Ng Valentine's? Ng Pasko? Ng April Fool's Day? Ano yun? So, 27th, ha? Ang sumagot ng 2 days later, magtago kayo sa akin, ha? Sinasabi ko sa inyo, ha? Hoy, pinapatawa ko lang kayo. Masyado kayo seryoso. Kayo naman, wala na nga tayong mga date, tapos sa seryoso nyo pa. Di ba? Pa, parang magsaya tayo kahit wala tayong mga date. Di ba? O siguro yung iba sa inyo nagmamadal. Tagal-tagal naman mag-lecture, Dr. Bibar. May lakad pa ako mamaya. Dami pa pasakali. Hindi na lang mag-lecture. Okay. Damay-damay na to. Wala akong date kaya hanggang alas 5 tayo mag-lecture. Okay. Joke lang po. Uy, iba nagtatago na sa akin, oh. Nagpapaganda na, oh. Nag-aayos na ng kilay, oh. Okay. This is the neural tube, the developing neural tube. And this will be your neurophore. So it should close. Otherwise, napakadali. Pag hindi nagsara si cranial neurophore, that will lead to anencephaly. Pag hindi nagsara si caudal neurophore, that will lead to spina bifida. Okay pa? Questions so far?
None po.
Okay. Parang si Navarro lang sumasagot sa akin. Dalawa na lang ba tayo Navarro? Iniwan na tayo nila Navarro. Tayo na lang dalawa. Na tayo eh. Kung Valentine's Day talaga, iwan na na. Dami-dami nang iiwan. Okay. Let's start with the development of spinal cord. Okay? This is the future. You've seen a cross-section of the spinal cord. Diba? Remember the slide of nerve cell, spinal cord. Nakita nyo na to. This is the gray matter inside and this is the white matter. Okay? So yung tinignan nyo dati na butterfly shape, that's the gray matter. Okay? And the gray matter is made up of, this part is posterior horn, this part is anterior horn. Okay? That's the gray matter, and it is surrounded by the white matter. And you have a canal here. It's your ependyma lining the central canal of the spinal cord. Okay, clear po? Okay. So this part is a neural tube derivative. But this part, yung roots, spinal nerve roots, it's a derivative coming from neural crest. Okay? So, dito siya galing, neural tube. This is the neural crest. The neural tube will have 3 layers. I want you to remember. Ependymal layer, mantle layer, and marginal layer. So, again, this is ependymal layer. And the next question that you should anticipate, what will happen to the ependymal layer? It will become the ependyma. Okay. This is the mantle layer. This is the alar plate. What will happen to the alar plate of the mantle layer? This will become the posterior horn of the gray matter. This is the basal plate of the mantle layer. What will happen? What is the fate of the basal plate of the mantle layer? This will become the anterior horn of the gray matter. Okay, and here is your marginal layer. What will happen to the marginal layer? It will become the white matter. So again, those are the questions that we're going to ask to you. The developing neural tube will have three layers again: ependymal, mantle, marginal. Ependymal layer will become the ependyma. The mantle layer will become the gray matter. Specifically, the alar plate will become the sensory horn or posterior or dorsal horn of the gray matter, while the basal plate will become the motor horn or the anterior or the ventral horn of the gray matter. Okay, when we discuss spinal cord, okay, the posterior horn, dorsal horn as the function is sensory, while the motor horn as the function, the anterior or the ventral horn as the function is motor. And again, the marginal layer will become the spinal cord. Are we clear po? Kasi so far po, clear po yun?
Yes po.
Okay. Here's another picture. We're going to show this in the laboratory. This is the ependymal. Again, ependymal layer here on the inner nose. What is the fate? Ependyma. Okay. This is the alar plate here. What is the fate? Again, that's your posterior, dorsal, or sensory horn of the gray matter. Okay. This is the basal plate. What is the fate? This is the anterior, ventral, or the motor horn of the gray matter. And the outermost is this one, marginal layer. And what is the fate? That will be the white matter of the spinal cord. Okay, anyway, that will be oriented to you in the laboratory in details later. What about the neuroepithelium of the neural tube? The neuroepithelium will give rise to the cells of the nervous system. You have your neuroblast, which will become the nerve cell, the glioblast, which will become the supporting cells, glial cells, astrocytes, and oligodendrocytes. And you have the ependyma, which will give rise to the ependymal cells. And there's another one, microglia. Take note, the cells of nervous system coming from ectoderm. With the exception of microglia, phagocytic cells are derivative coming from mesoderm. The phagocytic cells in the nervous system is referred as your microglia. Remember that, the phagocytic cells in the nervous system is known as microglia, derived coming from mesoderm. Okay? The phagocytic cells are actually derivative coming from monocyte inside circulation. But once lumabas siya sa circulation, iba-iba na pangalan niya. Depende kung saan siya nakalagay, nakatira. Ano nga tawag sa phagocytic cells ng liver?
Copper po.
Bone copper cells. Very good. What is the phagocytic cell in the lungs?
Dust cells.
Dust cells, alveolar macrophages. Macrophages, pwede. Tama? But when you see it, again, at the nervous system, we call it as microglia. Are we clear po? Okay, very good. There will be positional changes of the spinal cord. During embryonic period, the growth of the spinal cord, okay, is the same with the growth of the vertebral canal, which means sabay lumalaki, sabay umahaba si vertebral canal, vertebral column, at si spinal cord. But, okay, fetal life mas mabilis ang growth ng vertebral column at dura mater kesa sa spinal cord. And for these reasons, at 6 months of fetal life po ito okay, the spinal cord is usually seen at S1. At birth, it terminates at level L3, and in adults, it terminates at level L1. Again, take note, I'm going to ask you that 6 months of fetal life, spinal cord usually terminates at level S1, at birth, L3, in adult, L1, L2. Lower border of L1, upper border of L2. So this is adults. Ayan po. L1, lower border of L1, upper border of L2. So we're done with the growth of the spinal cord. Let's go now with the growth of the brain. Okay. 4th week of human development, you're going to have 2 curvatures, the midbrain flexure and the cervical flexure 4th week. And as a result, you have the formation of 3 primary brain vesicles. I want you to remember that, okay? What are the 3 primary brain vesicles? Again, take note, at 4th week of human development, the developing brain is divisible into 3 primary brain vesicles. For brain, midbrain, hindbrain, but specifically, I want you to remember it as prosencephalon, mesencephalon, and rhombencephalon. Prosencephalon, mesencephalon, rhombencephalon. Okay? 5 weeks. Okay? The prosencephalon will subdivide to become telencephalon and diencephalon. Mesencephalon will stay as is, while rhombencephalon will subdivide to become metacephalon and myelencephalon. Again, let's review what name the 3 primary brain vesicles. Anybody from section B? What are the 3 primary brain vesicles?
Prosencephalon, mesencephalon, and rhombencephalon.
Yes, tama naman, Dr. Castro. Formed during what week?
4th week.
4th week. 5th weeks. Okay. Name the 5 secondary brain vesicles. Oh, secondary brain vesicles.
Diencephalon.
Yun lang?
Diencephalon. Mesencephalon, metencephalon, myelencephalon.
Formed during what week?
5th week po.
Okay. Take note that mesencephalon is both a primary and a secondary brain vesicle. Clear po tayo?
Yes po.
Okay, very good. So here, okay, I'm going to attach a video kasi yung video na in-upload ko, hindi ko ma-play sa PowerPoint, but I'm going to attach it later, okay? So, you can watch it, you can visualize, okay, kung ano pong nangyayari, okay? So, from 3 primary brain vesicles formed during the 4th week of human development, it will subdivide to become 5 secondary brain vesicles formed during the 5th weeks of human development. And this will give rise, of course, to the parts of the brain. In details, okay, this is the video. Ipi-play ko po yan, ma'am. I-attach ko po sa Moodle yan para mapanood niyo po. Okay? This is the primary brain vesicles, 3 primary brain vesicles, and the 5 secondary brain vesicles, which will give rise to the parts of the brain. I want you to remember this part. Hanggang board exam, tatanungin po kayo dito, ha? Telencephalon will become the cerebrum. Diencephalon will become the thalamus. Mesencephalon will become the midbrain. Metencephalon will become the pons and cerebellum, while myelencephalon will become the medulla oblongata. Okay, I want you to remember that. When you say brainstem, brainstem is a collective term for midbrain, pons, and medulla oblongata. So brainstem derived coming from mesen, meten, and myelin. But if you're asking specifically, midbrain, mesencephalon, pons, metencephalon, medulla oblongata, myelencephalon. Okay? And these are the spaces. Whenever you encounter the lateral ventricle associated with cerebrum, third ventricle associated with thalamus, cerebral aqueduct associated with midbrain, while fourth ventricle is the common space for pons, cerebellum, and medulla oblongata. We're going to show you that in the laboratory later. Okay? For the spinal cord, the cavity to remember is central canal. Okay po? Clear po tayo? Okay? You're going to visualize that when you go to your laboratory later. We're going to show you that. Okay? Let's go back to the case. A prenatal screening showing an elevated maternal serum alpha-fetoprotein. Amniocentesis was done and confirmed an elevated alpha-fetoprotein. What should be included in the differential diagnosis? So whenever you encounter this, okay, you associate it with cranial neural tube defects. Alpha-fetoprotein is a glycoprotein which is synthesized by three fetal structures: the developing gut, the liver, and the yolk sac. It's a consequence of neural tube defects, not a cause of neural tube defect. It's a consequence. Kaya siya tumaas kasi nagkaroon ng neural tube defect. Okay? And these are the two types of neural tube defects to remember for this lecture: spina bifida and anencephaly. This is the developing neural tube. Earlier, we mentioned that you have openings. If for some reasons hindi magsara si cranial neuropore, that will lead to anencephaly. Okay? If for some reasons hindi nagsara si caudal neuropore, that will lead to spina bifida. Okay? These are the three types of congenital anomalies of the brain. As a result of structural anomalies caused by abnormal organogenesis, disturbances in the organization of the cells in the nervous system, resulting in mental retardation and errors of metabolism because of accumulation of toxic substances. Okay, this one will be discussed in your biochemistry class. Okay, this one will be mentioned in your physiology or in pediatric classes, but in anatomy, we're going to focus on the structural anomalies which is caused by abnormal organogenesis. Okay, let's go back to basic concepts. Embryonic period starts at what week? Third week, and it ends at what week? 8 weeks. Embryonic period from 3rd to 8th weeks of human development, after which, from 9th weeks until birth, is your fetal period. Okay? Clear pa? Okay. Embryonic period is said to be the most critical period of human development. Take note. The most critical period of human development. And what is the reason behind that? This is the period of organogenesis. Organogenesis meaning to say, this is a time period wherein the different organs will be formed. And one of those will be the nervous system. Okay? Take note that neural tube defects, defective closure, of the neural tube, usually occurs at the 4th week of human development. 4th week of human development. Okay? Etiology, nutritional factors, environmental factors. Environmental factors, for example, radiation, drugs, chemicals. Nutritional, of course, poor nutrition. Diba? Di ba pag sinasabi sa buntis palagi, pag alam na buntis siya, kumain ng gusto. Di ba? Dapat hindi maninigarilyo, the exposure to drugs, chemicals, radiation, etc., etc. Otherwise, baka magkaroon ng congenital anomalies. Okay? Recent evidence proves that folic acid or folate reduces the incidence of neural tube defects by as much as 70% if a dose 400 milligrams to be taken daily, beginning 3 months prior to conception and continuing throughout gestation. So, ang recommendation ng studies, even before magpaplano kang mabuntis, in the future mga doktora, kung nagpaplano na po kayong mabuntis, dapat pala umiinom na ng folic acid. So yung mga vitamin preparation in the future na ibibigay nyo, ipiprescribe nyo sa mga pasyente nyo, merong folic acid yun or folate. Okay pa? Okay. Again, what is neural tube defect? Neural tube doesn't form right and the baby's brain or spine is damaged. Take note, it happens within the first few weeks of pregnancy, often before a woman knows that she's pregnant. Anong sabi natin? At what week usually nangyayari ang neural tube defects? May sinabi tayo?
4th week po.
4th week. Tandaan niyo po yan, ha? Okay. O, magbigay tayo ng example. Diba? Ako, February 14 ngayon, maraming ganap ngayon, maraming kaganapan mamayang gabi. Ako, yan na. Alam mo yan, Roy, di ba? Kung, kung planado naman yung pregnancy niya, di ba? Kung planado niya, gusto niya mabuntis, di ba? 14 siya ngayon. So, kung meron kang ganapan mamaya, so, kailan siya mag-anticipate na baka buntis siya? A month after, kasi wala na siyang menstruation. Di ba? Tama. So, 1 month after or 5 weeks, ako, wala akong menstruation. Tignan ko nga pregnancy test ko. Positive pregnancy test. Nagpa-ultrasound siya, positive ultrasound. Buntis siya. Pero, ayan, maliwanag. Neural tube defects happens within the first few weeks of pregnancy, often before a woman knows that she is pregnant. Eh, paano kung meron na palang neural tube defects? Nakukuha niyo pong ibig kong sabihin?
Yes po.
Okay. It can cause lifelong disability or even death. Okay? But with the technology nowadays, okay, sa ultrasound pa lang malalaman na kung merong neural tube defects. Okay? And with the technology nowadays, you might be surprised, even during fetal life, pwede nang i-repair yung neural tube defects. Okay? Again, it can be prevented as much as 70% by giving enough folic acid every day, starting before a woman gets pregnant. Diba? Clear po?
Yes po.
So, Dr. Roy, huwag ka na magbigay ng chocolate, roses. Ang chocolate, nakakapag-diabetes yan. Ang roses, nalalanta. Magbigay ka na lang ng boxes of folic acid in the future. Matagal ba may expiration yan? Mga 3 or 4 years pa. Okay? So, bigyan nyo na lang folic acid. Clear po tayo?
Yes po.
Okay. Spina bifida. O, tignan nyo nga yung likod nyo. Kapain nyo nga yung likod nyo. Baka meron kayo niyan, no? A dimple at the back. At pwede rin akong dimple sa likuran. Okay? With some hairs pa, buhok-buhok. Okay? We call it as spina bifida occulta. The problem here is there's non-fusion of the embryonic hubs of the vertebral arches. Yung vertebral arch hindi nag-meet together. So there could be a depression, okay, that could cause a dimpling of the skin and with some hairs. Huwag yun na akong tanungin, bakit may buhok, mga anak ha? Wala. Ilang neuroanatomy books na pong nabasa ko, walang sinasabi. Bakit nagkaroon ng buhok, di ba? May mga bagay na mahirap ipaliwanag sa mundo, mga anak ha? Okay. Yung tatanungin, bakit, Dok, ba't nagkabuhok? Okay. Are you going to have neurological presentation? L5 or S1 or lumbosacral segment, take note that no clinical presentation. It's normal. The only abnormality here is the presence of a dimple at the back with some hairs. Otherwise, it's normal. We need to say no motor losses, no sensory losses. These are the two major presentations of a spinal cord involvement, either motor loss or sensory losses. Okay? Spina bifida occulta, but this one is different. There's a cystic mass at the back. May bukol. Ano kayang laman niya? Depending on the content, we can call it as spina bifida cystica, meningocele, or meningomyelocele. Follow the name. Meningocele, meninges with CSF. Meningomyelocele, meninges with CSF plus myelo, which means meron ng spinal cord involvement. Maliwanag po ulit. Meningocele, meninges with CSF. Meningomyelocele, meninges, CSF plus spinal cord. Okay, and take note that this is still covered with a membrane. Okay, to differentiate this with the worst type, call it as spina bifida with myeloschisis. Look at this picture. The spinal cord is open. Wala nang covering. Okay? So this is the most severe type. Okay po? Again, this is your occulta. The only problem here, hindi nagsara yung vertebral arches. So you have skin dimpling and with some hairs. No neurological presentation. This is meningocele. Okay? Meninges with CSF. This is your meningomyelocele. Meninges CSF with spinal cord involvement. And this one is your myeloschisis. Because you can see clearly the spinal cord. No more covering. Okay. Ulit, question. Are you going to have neurological deficit in A? Yes or no?
No.
No
Okay. In B, yes or no? In B, yes or no? Uy, yes or no lang mga anak. Abuti tayo alas 5. Yes or no?
No po.
No. In letter C,
Yes,
Yes po.
ayun na yung spinal cord, no? Anong, Sa tingin niyo, pag naipit yan, wala po presentation?
Meron na po.
Meron
syempre.
pala.
And of course, eto lalo, meron na. Maliwanag po yun, ha? Okay, okay po?
Yes po. Yes po.
Okay. So, lumbar meningomyelocele, what does it mean? Ano laman ito pag sinabing lumbar meningomyelocele?
Meninges with CSF plus spinal cord.
Are you going to have neurological deficit?
Yes po.
Yes po. Okay. Again, this is your occulta. This is your meningocele, spina bifida cystica. Meningocele. This is your meningomyelocele. And this is your meniscus. Okay. Another one. So that's your spina bifida. Okay. Can it be corrected? Depending on the severity po, of course. Okay. Again, this is your occulta. This is your meningocele, meningomyelocele, and meniscus. Okay, take note that here in meningocele and meningomyelocele, you still have covering, but this one, meniscus, spinal cord is open, no more covering. Okay po, clear po?
Yes po.
Okay. Again, this is occulta. Hindi lang nagsara yung buto, nawawala, di ba? This is your meningocele. Okay, this one, pag may covering, meningomyelocele. Pag wala ng covering, meniscus. Okay? This is cranium bifidum. There's defect here in the formation of your squamous part of the occipital bone, and as a result, you have to try to visualize that the brain will protrude, will herniate to form a cystic mass at the back of the head. Okay? And depending on the content, we call it as meningocele. Only the meninges will herniate. Meningoencephalocele. Encephalo means part of the brain, and the most commonly part of the brain that will be the first to herniate will be the cerebellum because of its position. Cerebellum is on the most posterior, right? It's a cerebellum. And when you say meningohydroencephalocele, you have the involvement of your ventricular system. Ventricular system. Lateral ventricle, third ventricle, fourth ventricle. And if you have involvement of the ventricular system, you have your CSF. Okay? So, ulit ha, pag meningocele, without CSF. Pag meningohydroencephalocele, may CSF. Dok, bakit doon sa spina bifida cystica meningocele, meninges with CSF? Pero pagdating sa cranium bifidum, cranial meningocele, meninges lang, walang CSF. What is the explanation for that? In the spinal cord, the CSF is located at the subarachnoid space between the meninges, arachnoid, and pia. But in the brain, the CSF is located at the ventricular system. And that's the reason behind that. Clear po?
Yes po.
Okay, very good. So here, in the future, you might encounter a baby born. Okay? This is cranium bifidum. Iba yung hydrocephalus, ha? Nakakita na ba kayo ng baby with hydrocephalus? Pag hydrocephalus, ito yung lumaki, this part. Diba? Hydrocephalus. Okay? The problem in hydrocephalus is obstruction of the flow or excessive production of CSF. But the end result is marami kang CSF. Kaya lumaki yung hydrocephalus. But here, the problem again here is this part. May butas. Again, this is your meningocele, only meninges. Meningoencephalocele, again, most likely it's a cerebellum, encephalo. And here is your ventricular system. So which means you have already CSF. Are we clear po?
Yes po.
Okay, very good. Okay, you're going to learn when you go to neuroanatomy. If you have cerebellum, compression of the cerebellum, you're going to have neurological manifestations. Okay, you're going to learn that. Exencephaly. Pinanganak, walang cranial bolt, skull top. So it's open. Which means hindi nagsara yung cranial neuropore. And if it is open, the brain may be necrotic. Tissue degeneration, there could be a mass of necrotic tissue. And we call it as anencephaly. Okay? Not really that these terms, exencephaly, anencephaly, are interchangeable terms. Pareho lang sila. Pero pag meron na nga necrotic tissue degeneration, specifically we call it as anencephaly. So, yung brain niyan ay sira-sira, di ba? In worst cases, nag-degenerate na. Okay po, are we clear?
Yes po.
Questions po? I'm going to embed the video kasi hindi ko po ma-play yung video eh. Meron po akong dalawang video. So I want you to watch it later. Okay? Immediately after your class later, I'm going to attach the videos. Okay po, questions?